All right. We start with the sympathetic division. So fight or flight, thoracolumbar, okay, function and location, active during periods of those things, anything that requires us to be smartest, fastest, strongest, quickest, all of those things. It increases alertness, metabolic rate, heart rate, blood pressure, airflow, sweat, and blood glucose. All things which have a benefit if you're going to fight off a mountain lion, right? Got plenty of blood sugar, you're nice and cool, you got plenty of oxygen, and plenty of blood flowing around to do your thing. Sympathetic division, we talk a lot about the physiologic effects. Sympathetic also does a number on your brain too, okay? Like the sympathetic response, it reduces fear, it reduces your sensitivity to pain, it increases aggression, it reduces digestion and urinary function. So there's a lot of stuff going on in this sympathetic reaction. In parasympathetic, it's all opposite. Rest and digest. Most of it comes from 10, 3, 7, and 9. Decreases metabolic rate, heart rate, blood pressure, respiratory rate. Best way to think about what does parasympathetic do to your body, it's like when you're asleep, right? Your blood pressure is low, your respiratory rate is low, everything's low, right? That is parasympathetic is winning. Parasympathetic increases blood flow to the GI tract, and it increases all of the digestive secretions, including saliva. It stimulates motility of the GI tract. It stimulates urination and defecation, all of those things. So thus the rest and digest. Now, oftentimes somebody will ask, well, wait a minute, I thought if you got scared enough, you would defecate and urinate yourself, right? That's true. But it's not because of parasympathetic stimulation, it's actually because of sympathetic stimulation. One of the things that the sympathetic system will do in overdrive situations is it will basically get rid of anything it doesn't need, right? And that's what that's about. If you're running and fighting for your life, apparently you don't need to hold on to your urine and your poo to do that. All right, and it triggers the storage of nutrients. So there are a number of metabolic switches that sort of put our body into metabolic storage versus use. This is one of them. So under parasympathetic stimulation, we tend to store up nutrients in the form of glycogen. We tend to create lipid as opposed to burning lipid, and we tend to create protein as opposed to breaking it down. So all of those things sort of go together. All right, so very important slide, as I say right on the slide, right? So this is my comparison points between sympathetic and parasympathetic, right? So location, you have craniosacral, parasympathetic versus thoracolumbar. Where are the ganglia? Nearby, far away. Where the preganglionic fibers are short and use acetylcholine in the sympathetic division. The preganglionic fibers are long and use acetylcholine in the parasympathetic division. Remember at this stage right here, same receptor, right? Nicotinic receptor right there. Postganglionic fibers are long in the sympathetic division. They're short in the parasympathetic division. And then the general functions are sort of opposite, fight or flight versus rest and digest. And then our receptor type overview, right? So alpha 1, alpha 2, beta 1, beta 2. Beta 3 isn't even on this one, but I do want you to know beta 3 too. Remember, beta 3 causes release of fatty acids from adipose tissue. And then our nicotinic and muscarinic receptors. All right.